clinicians. So I'm just going to show you some examples of someone who's got an Alzheimer's dementia. So the first one, and this one's a small little series. This is when they were 80 years old. They have a relatively well-formed alpha rhythm, or I should say preserved alpha rhythm of about 8 hertz. You can see some occasional underlying slow waves here in the temporal regions, mainly on the left-hand side, but overall this would be a standard EEG for someone in their 80s in terms of what we tend to expect. So not a perfect EEG, but not particularly abnormal. A couple of years later, we can already start to see that alpha formation has slowed a bit. It's not so posterior anymore. There's more underlying slow wave activity, both sides now, but mainly on the left. And then a year later, we can see further slowing. We're now down to 5 or 6 hertz, and there's more pronounced slowing within the background. And actually, this highlights something very interesting to Alzheimer's, which is Alzheimer's is actually quite a common form of dementia, and vascular issues which can result in this panoply and spectrum of underlying slow waves can easily affect anyone who's got Alzheimer's just because of the nature of age and so on. So it's very seldom that you see very pure pathology. This is a different example of someone with Alzheimer's, this time much younger, and we can already see at the age of 63 here, they came in already with moderate slowing, and then a little bit later on, this is 4 years later, we can already see very severe slowing at this point. So Alzheimer's is very much a progressive disease, and we see progressive slowing when one does serial EEGs. In contrast, this is someone who's got a confirmed Lewy body disease, and we have this very characteristic mixed slowing of theta delta patterns. And as I've already alluded to, the one time is, do they have Lewy body disease or do they have frontotemporal dementia? And I have seen this type of conversation happening. The EEG can actually be quite useful as a discriminator. In Alzheimer's, it may just show some relatively mild slowing perhaps. Lewy body disease, it might show something like a mixed theta delta pattern, and in the frontotemporal dementias it may be entirely normal. And so even having a normal EEG should never be written off in the case of a dementia, because sometimes a normal EEG can be a particular characteristic of that type of dementia. Now, of course, we have other entities too, which the EEG can be particularly useful for. For example, prion diseases such as CJD, where we have these short interval periodic discharges, and variant CJD, which may just show some slow wave abnormalities, and of course the Heidenheim variant of prion 2. So this is a sort of typical EEG in a standard prion disease, where we have these short interval diffuse periodic discharges. And this is an example of a Heidenheim CJD I saw a number of years ago, where you can see these posterior discharges over here, and their presentation was very much with visual misperception at the beginning of their disease. So when and how can an EEG be useful in investigating dementias? So in standard clinical practice, as a